This is Dr. John Ferguson, Family Wellness Chiropractor, and I want to talk to you today about the impact that head and neck injuries have on the body in terms of short and long-term consequences and health. A study done out of Yale University shows that it only takes 8.2 miles an hour, which is a very slow impact in things like a motor vehicle collision, or looking at childhood. Riding a bike, falling off, hitting your head. And very commonly we see in more sports, head injuries, women's soccer, men's soccer, ice hockey, football, and other sports where there's collisions or direct impact to the head. Not only can that cause concussion or injury to the brain itself, but we know through research that the neck is also going to be affected. And the mechanisms by which that happens is we take a look at the spine itself. There should be a curve to the neck and the skull is sitting on top. Anytime there's a direct impact to the head, we see that the neck is also going to move as well. Many times it goes into a whiplash type movement that causes overstretching of blood vessels, nerves, ligaments, and tendons, which can lead to short and long-term pain and problems. As a chiropractor, what I specifically look for, and the reason why we do specific x-rays and exam, is what we call a subluxation, which is a misalignment to the spine that disrupts the normal neurological flow of information. It's a disruption of the normal muscles, ligaments, and tendons that have to support the spine and the skull area as well. When those nerves are chronically irritated due to a misalignment or lack of proper curve or alignment to the spine, we commonly see things like migraines, headaches, even patients with fibromyalgia or multiple sclerosis, carpal tunnel and neck pain, neck issues as well. And it's not uncommon to see patients many times in their 40s or 50s, and we see through a thorough consultation that there might not even have been a recent trauma or injury, but we could date something back to 15, 20, maybe even 30, 40 years ago, as far back as childhood, where there was a direct impact to the head or neck area, which over time has caused chronic irritation to the nerve system. There's evidence within the spine of long-term degeneration. So we know that it's not something that might have been recent, but a long-term consequence of an injury earlier in life. A medical doctor is going to take x-rays and look for things like a fracture or a tumor or missing parts. We're taking a look through a motion study of the x-ray pictures to see how well the spine is moving and whether or not there is proper alignment in curve and structure. So if you or someone you know suffering with any of those illnesses, symptoms that we mentioned, it could possibly be due to long-term injury of the head neck area and possible subluxation within the spine. So if there's something that you're looking forward to improving with your life, not suffering the same debilitating pains or problems, I encourage you to give us a call or find a chiropractor in your area that does specialize in this type of care. Look forward to talking with you soon.